Mpox. Remember that? A huge story we were covering at this time last year, and in fact for months. Well, Mpox is back in the news today with a new and more deadly strain circulating. New research done in part by Canadians has found it is spreading through sexual contact. We had vaccination campaigns in cities like Toronto last summer, but some of the places being affected by this new strain still don't have access to vaccination or to therapeutics or the things that make a difference, especially prophylactically. Lauren Pelly is here in studio this morning, and if you go online, CBCNews.ca, you'll find an extensive report there. She's been looking at the new studies, looking at the new findings, and thanks for coming in to report on it with us. What is the situation, part of what you've been looking at and part of what these studies have been looking at, what's happening in the DRC? So why don't we start there? What's the situation? Well,
there's always been two main strains of Mpox, two clades. The one that spread globally last year, sparking a massive outbreak, was milder. It could still kill in certain circumstances. It created a lot of pain, lesions all over people's bodies. But this other strain is more deadly. It's thought to be about 5 to 10% of people who are infected can die from this. So to put that another way, if that's 1,000 people who catch it, that could be 50 to 100 deaths. So the situation in the Democratic Republic of the Congo is quite dire this year. We're seeing about 12,000 suspected cases, nearly 600 deaths with this deadlier strain. It's not the first time the country has had this type of outbreak, but what is new is that researchers, including some Canadians working with a team in the DRC, have found examples of sexually based transmission for the first time. Now, if you remember, in that outbreak that happened globally, it was also spreading through sexual networks. This is the first time we're seeing this with a deadlier strain of this virus, and that's what has researchers on high alert here. So what they did is they looked at a cluster of infections that seemed to be traced through sexual contacts, and one of the researchers was actually in Toronto. Let's take a listen to what he had to say about their findings.
In the 2022 calendar year, there was transmission of Mpox among the men who have sex with men community. And prior to that, there was no reported cases of Mpox among the MSM community in that country. It very likely happened, it just hadn't been reported.
So that was an interesting point from Dr. Isaac Bogosh. It may have existed, but this is the first time that research is documenting it and sharing it globally.
Exactly.
Speaking of sharing globally, in this time, you know, international travel, people move around. So even if this is going on in Africa, it's obviously a concern everywhere. What about in Canada? What's the situation here?
Well, first off, Canadians should not panic about this, but we do need to be aware, as you said, that we live in a global village. And we've seen with COVID, we've seen with Mpox, these viruses can travel quite fast. So that's why researchers are concerned if a more deadly strain is capable of spreading sexually. We should be worried about that. We should be watching for it. So what I've heard is, again, we don't need to panic, but we need to be vigilant. We need to keep doing surveillance. We need to be doing that on the ground in Africa, a place that in many countries has been dealing with Mpox for far longer than we did in Canada, the US, and other nations. I spoke to one scientist in Nigeria who's working alongside other Canadian researchers to try and track how this virus is spreading, because there's some major unanswered questions. What are all the different types of animals that can catch it? What are all the ways that it can transmit? They're trying to figure some of those things out. Take a listen.
I think we still have a number of questions to answer because even though we've had this virus with us, you know, but because we probably didn't pay much attention to it, and so we didn't do much research. But right now, there's a lot going on.
Now, one of the big concerns with this situation right now is the fact that in Africa, in places like Nigeria and the Democratic Republic of the Congo, those countries have very little access to therapeutics or vaccines. So essentially, we have a very dangerous strain of this virus spreading in certain regions in a place where they're not getting the help they need. So that's another big thing scientists said, is while we're tracking this, while we're watching this type of virus, we need to make sure we have vaccine equity in Canada, the US, Europe, and in Africa, where people have been dealing with this type of virus for much longer.
In your online piece, you talk about the massive red flags that all of this is raising for the Canadian researchers involved. Thanks, Lauren, for coming in. And again, CBCNews.ca if you want to read more about Lauren's reporting on Mpox today.